Today I am going to talk to you about a very important diseases which attack the respiratory system. You must have heard the heading suppurative lung diseases. Suppurative lung diseases. Suppurative lung diseases is a class of diseases of the lungs. Namely, now from today onwards, if I ask a question, anybody can answer type the answer. Otherwise, I have the list of students, I can pick the names. If you can answer, it's okay. If you don't answer, no problem. I'm here to give the right answer. But if you know the answer, please type and you can see that.
They can tell in the audio also, sir. I'll switch the audio on here.
Okay, if you want, you can tell the answer in the audio also. Okay, and you can type and you can tell also. You can show the film.
Yes, we can show, and if you want to show, you can draw with this and show. Otherwise, I'll project this.
Anyway. Laptop nahi hai.
iPad we can show.
Okay. Yeah. So, yeah, that's a group of diseases called suppurative lung diseases. Suppuration means pus. Wherever there is a pus, you call it as a suppuration. Suppurative lung diseases. What are the diseases that come under suppurative lung disease? Anyone? 1 minute. I'll ask Syed Samina Sultana. Syed Samina Sultana. Can you answer this by typing or switching on the audio? Samina, are you there? Okay. If Samina is there, I'll go to Sai Tejasvi of Apollo. Sai Tejasvi, Apollo Medical College. Are they responding? Okay.
Aisha from Shadan, 13 batch.
Aisha from Shadan, yes. Can you read the answer?
Lung abscess, it's him, sir.
Very good. Lung abscess is very good.
Raina Shadan, 218 batch. Pneumonia.
Pneumonia is not the right answer.
Rahim Shadan, 2K16 batch. Empyema.
Rahim, you are right.
Sadaf VRK, 2K16 batch. Bronchiectasis.
Sadaf, you are also right. So
Sudarshan
Reddy.
Bronchiectasis.
Sudarshan Reddy, Sadaf, you are also right. So that's a good response. I'm happy. There are 3 diseases that constitute the suppurative lung diseases, namely bronchiectasis, lung abscess, and empyema. These are the 3 diseases that we are going to talk about today. These are the group of diseases that constitute the suppurative lung diseases. We'll take one by one today. We'll start with bronchiectasis. What is bronchiectasis? Bronchiectasis is an abnormal, irreversible dilatation of the bronchioles. Abnormal, irreversible dilatation of the bronchioles. So actually, bronchi and bronchiole. Actually, it's not truly speaking, it's not a disease per se. It's not a disease. It is the end point of so many other pathological conditions. Bronchiectasis is not itself by itself is not a disease. It's only an end point, a final point of some damage because of something else that we are going to come to. So, but we call it as bronchiectasis, a disease, but it's not a disease per se. Okay. What will happen actually, and what will happen in bronchiectasis? Ectasis. The very meaning of ectasis, when we say ectasis, it always means dilatation. Wherever, even if you dolichoectasis or coronary ectasis, wherever any tube, be it a cystic duct or common bile duct or even coronary arteries, when they get dilated because of some disease, we call it as ectatic vessels, ectatic vessels or ectatic duct. So bronchiectasis means dilated. That is the literal meaning, dilated bronchi and bronchioles. That is the pathology in bronchiectasis. So I think I'll show you here.
I'll drop it.
No, it's okay. It takes a long time. Suppose you take one of the tubes here. Can you see? Can you see?
Yes, sir, we can see.
You take one of the tubes here, one of the airways. This is a normal airway. In bronchiectasis, what happens is the wall becomes thick and big, dilated. That is the pathology. Wall becomes, this is normal one. This is the ectatic airway, bronchiectasis. The wall becomes thick and it becomes dilated, big. So in that, there are 3 or 4 shapes that are described depending on the different patient's situation. One is the tubular. There is only tubular dilatation. One, tubular. Second is saccular, something like that. Saccular. Third is, can you see that?
Yes, sir.
Third is cystic. So these are the 3 or 4 types of abnormal dilatation of the bronchioles or bronchi which are described. Tubular, cystic and saccular. So these are the various types of abnormal ectatic bronchi and bronchioles. That is the different shapes, abnormal shape. Okay, what is the cause? What are the reasons? What is the etiological patterns of bronchiectasis? Okay, one is post-infectious cause. Post-infectious cause. Any infection can damage. Yesterday, as we were talking, any infection can damage the airways. The epithelium of the airway is damaged, thereby damaging the cilia also. The beautiful mechanism of cilia, I'm sure you must have read in physiology. The cilia, the microvilli or microcilia, which are millions in number, they keep beating up like that. See, suppose this is a tube here, this is airway here. The cilia, the microvilli, microcilia, they upbeat like this. They come back slowly, go up. Thus, they're propelling the mucus layer which is on the top. It's like a conveyor belt. You must have seen in the big factories of cement or some stones or coal mines, coal factories. There's a big conveyor belt. It transports the raw material of sand or coal and cement and all that. Something like that. It's like a conveyor belt. The cilia beat and the layer is pushed up, and along with that the unwanted particles of virus, bacteria, dust, they are drained out, they're brought out. So that is the defective ectatic vessels, because there's a damage, there's a thickness, there's an enlargement, there's dilatation, the villi are disturbed, the function of villi get impaired. Therefore, the mucus clearance is impaired. Therefore, there's an infection. So infection causing damage, any infection causing damage to the this mucous membrane and the cilia, any infection in the be it a bacterial, viral, or fungal, anything. So that will damage in some people, because as I told you, bronchiectasis is not a very common disease.